Well, let's get this one first. This is a fresh controversy today with new remarks from President Trump on autism. Yesterday, he was joined by his medical team to directly tie the condition to Tylenol, urging pregnant women to avoid the medication altogether. Now, medical experts are already warning that the claim is not backed by science and could put mothers and infants at risk if it leads to untreatment for fever and pain. But the president is standing firm, delivering his stark warning about Tylenol and pregnancy.
Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born.
The president's comments are already igniting strong pushback from doctors and public health experts who say there's no clear scientific proof linking Tylenol to autism. They warn the bigger danger may be the discouraging pregnant women from treating fever or pain, both which can carry health risks for the mother and the baby. To break down what is fact and what is speculation and what's expecting families should know, we're joined by Dr. Daniele Fallin, who's the Dean of Public Health at Emory School of Public Health. Welcome back to the show.
Thank you so much.
All right, we had you on a couple of weeks ago. We were, talking about some of this making headlines, and now the announcement is made here. How surprised are you to hear this coming from the White House?
Well, given the preliminary hint at this, I wasn't surprised, but I am nonetheless disappointed. The evidence for acetaminophen in autism is mixed at best, and recent studies have not shown a link between acetaminophen use in pregnancy and autism. And as you already pointed out, we know that there's potential harm in removing or restricting that acetaminophen use.
Yeah, what does this moment tell us about keeping science and politics separate from public health communication?
I think it's really important that President Trump is not your doctor. And so speaking to your own healthcare provider while you're pregnant is the best thing you can do for you and your baby.
So what does the science actually say about the use of Tylenol in pregnancy and the risk of autism?
So I should say it's really important that we continue to shine a light on research in autism, and I welcome that aspect of this moment. But unfortunately, to make a recommendation about acetaminophen is just premature. The evidence right now is mixed.
Yeah, this has been going on for a while, at least, so we've been hearing about a possible link. Is there a certain trimester that doctors are more cautious about the use of Tylenol than others?
For autism links, we do not see that there is a particular window where acetaminophen use would be harmful.
If a woman stops using Tylenol, what are the potential risks? We talked about it, but what are the potential risks that could occur?
Yeah, so we know that fever during pregnancy can be harmful for birth complications and for the development of the new child. And so we want to prevent or protect from fever as much as possible during pregnancy, and acetaminophen is the tool available during pregnancy for that purpose. Yeah.
Are there any other common medications or supplements that have stronger evidence concerning this about pregnant women?
If you mean, are there other medicines for fever during pregnancy? Unfortunately, no. If you mean, are there other medicines to ask questions about risk for autism? I think we can continue to ask and answer those questions, but so far there is no consistent evidence that there are medicines during pregnancy that are harmful to autism.
So what should new mothers or even pregnant mothers know about this particular alert that's going out?
That it's most important to talk to your obstetrician or care provider and work together using their advice about what is best for you and your baby.
Is that the one clear message that you would give families that are watching right now?
Absolutely. Please talk to your trusted care provider.
Yeah. This is obviously having a ripple effect, obviously, throughout communities everywhere, people wondering about autism and Tylenol in particular. But what about other medications that are out there? I hear you saying that you should consult your trusted healthcare provider, but there are over-the-counter drugs that maybe if you have a fever or if you start to feel some pain, you may go for. Is there something that they should not be buying other than Tylenol? That they may have a question about?
We know that acetaminophen is the best known and safest drug to be used during pregnancy for fever and pain. And so I would recommend speaking with your care provider about use of acetaminophen before you seek other kinds of pain relievers or fever relievers. And in fact, some of those may be much more harmful, and evidence has clearly shown that some other pain relievers and fever treatments are not safe during pregnancy.
How does the medical community turn this around, at least turn this message around?
I think we have to to continue to do our job to communicate directly with our communities that acetaminophen so far is safe for use in pregnancy.
Dr. Fallin, thanks so much for joining us. Really appreciate the message that you brought and the insight as well. Thank you so much.
Thank you.
All right.